So ladies and gentlemen, we went through the central nervous system exam. I said we'll have a separate video for cranial nerve examination. So cranial nerve, they serve as one among the high centers, and these are cranial nerves that we are going to cover. So there's cranial nerve number 1, olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocholear, glossopharyngeal, vagus, accessory, and glossopharyngeal. These are arrangement of our nerves. I already said there's a statement which you're not supposed to use. Don't say that all cranial nerves are intact. I expect you to tell me that I examined the following cranial nerves: cranial nerve number 1, which is the olfactory nerve, and the patient was able to respond to smell; cranial number 2, optic nerve, the patient was able to see different distances. That's how I want you to be able to report this from the first up to the last one. So how are we going to do these exams? The first one is olfactory nerve. So this assesses smell. So you can start just by asking the patient, have you noticed any changes of smell pattern recently that you're unable to distinguish a certain type of smell? And then if the patient says no, now you can also do the exam. Well, by now you're going to find something which has a common taste, common smell, I mean. For example, you find something like an orange, a banana, and sometimes it's soap, but it shouldn't be pungent in case. So you tell the patient now to close the eyes while you're exposing to that smell and see if he's able to detect. And another one is optic nerve. So what is the optic nerve able to do? You're able to check visual acuity, and you check visual field, and then you're able to check color discrimination. Yes, and you're able to go to papillary reflex. So, for example, in the visual acuity, you're trying to see if the patient is able to see at different distances. For example, now you can try to put the patient in different distances, from 1 meter, 2 meters, maybe up to 10 meters. And then you can have your Snellen's chart, which is a Snellen's chart is a collection of letters which actually decrease in size as you keep on going down. So you can put that chart at a different distances, and you ask the patient if he can actually see those letters respectively. So after that, you'll be able to report and say that there is a problem with the optic nerve, as my patient was unable to see from 5 meters and above. If you don't have the visual, the Snellen's chart, you can also use your hands for that mistake. Another thing is the visual field. So visual field, you're going to use the H pattern. You're going to quickly check the fields of the eye. Exactly. So there's also the upper field, the lower ones, and the nasal field. So you're going to use all that. So what you're going to do, you're going to tell your patient to close one eye like this, and then now the patient has to, on the other eye, it has to now start tracking like from different places like this. So it normally goes in the H direction, checking all the fields to see if there's any problem. And then another thing is color discrimination. So I think you noticed there's something called color blindness. Yes, so you should bring something with color which is able to discriminate, especially from red, yellow, green, something like that, and blue, and if he's able to discriminate between those colors. So I hope you've understood for cranial number 1, olfactory, and cranial. And then we go to cranial nerve number 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens. So this is responsible for eye movements. So now you're going to ask the patient to follow your finger at different directions. So make sure you test all those eye movements which are responsible for the eye movement, different muscles such as the rectus muscle, which is responsible for different movements of the eyes too. So you can tell the patient to now try to follow your finger, go down low this side, and see if there's any restriction or if there's any ptosis. Very important. So if there's any restriction, you can tell there's a lesion. That's why the patient is unable to maybe follow your finger down low or maybe up. And then after that, you go to the trigeminal nerve. So trigeminal nerve is one among the very unique nerve, as it has both motor, and sensory components. So in sensory, you're going to test for touch, which can be both crude and fine touch, pain, and maybe you can test for temperature. So for example, in touch, you can assess for maybe fine touch by using a prick, you see. So you're going to check the ophthalmic part, the trigeminal, then you go to the maxilla and mandible. So these are the places where you're going to put that. Maybe if it's your fine touch, your pointed pen, ask the patient to actually close their eyes and see if that patient can respond to that touch and tell you where the touch is actually placed. So you can also check for pain, the same thing, and you can also check for temperature. So these are the things that you're going to check during the sensory. So in the motor part of trigeminal, you're going to assess the motor function. So as you know, this is something called muscles of mastification. So when you are trying to eat now, those muscles are responsible for you grinding the food and things like that. So you have your temporalis muscles, and then you have your masseter muscles. So you can just tell your patient to clench the jaws. So like maybe bite your jaw, your teeth, like grind your teeth, and then now you start feeling for those muscles. And then you can also tell the patient to open the oral cavity and see and then try to force it to close. So you're also going to test also the same muscles of mastification in cases of the motor trigeminal part. Then after that, you go to the facial nerve, which is cranial nerve number 7. So in the facial nerve, you're going to ask the patient to raise the eyebrows, and you can ask the patient to actually blow, and then to see if you can actually resist that. So by doing that, you're able to know that also the motor function of the facial nerve is also not affected. So you're also going to test for this thing called vestibulocholear. So this one just is responsible for our hearing, you see. So you're going to use our tuning fork, which has different frequencies, and then now you tap the tuning fork and then you place it just beyond the ear, and then you ask the patient to actually feel for any vibration and stuff. So you can do the Renner's test or the Weber's test. So, and then after that, you have the glossopharyngeal nerve. So you can ask maybe if there's any change in the taste pattern, like is he having a hard time to differentiate different tastes of food, maybe a sour food, bitter, and different types of taste. And then you can also do the gag reflex, assess for also taste. So in the gag reflex, you're going to take maybe a cotton bud, then you ask the patient to open the mouth, and then now you're going to go to the most posterior part in the pharyngeal muscles, and then you try to release it, and response, then the person will gag out. So that is the gag reflex. And then you're also going to check for the hypoglossal nerve by asking the patient to take the tongue out. So normally if there's a problem, the tongue will point to the area of lesion, understand? So in this case, if you have a stroke patient, this thing will be covered, exactly. And then you have your accessory muscles, accessory nerve. So the accessory nerve, which is our cranial nerve number 11, you can ask the patient to shrug the shoulders. So this will present the accessory nerve if the patient is able to shrug the shoulders against the resistance. So I think we've already covered all the cranial nerves that you're supposed to cover, and I hope that you can report them like this. So I expect that you report the cranial nerve exams that you've done. I examined cranial nerve number 1, which is olfactory. Then you tell us what you did and what did you find. You go to the second one, the optic nerve, and tell us what you're looking for. Tell us what you found and how you did it. Go to the oculomotor together with the trigeminal abducens. You tell us and what you tested for and what you found. The same applied to all the other cranial nerves. And then at the end, you try to tell us the remarks that you have found which were positive and negative. So I hope it's well understood.